the public option has been tried throughout America. It's pretty much blown the budget. What expectation do we have at this point that we're not going to end up massively over budget? And if we do, how is it possible to control costs on immigration and care?
Well, and that's the concern that a lot of us have raised about the public option. Now, there are a lot of folks, certainly the advocates for single payer, see the public option as a compromise. Over in the Senate, they're talking about a different thing entirely that gets away from the public option. But I would get back to that trigger that I talked about. I'm concerned a lot about the trigger, that the pay for it is important. The pay for it is really important to at least the folks that I talk to within the cause. Well, that's just it. If in fact the trigger is it, then we need to get away from what was intended in the bill, make the modifications so that we don't have to increase taxes, or certainly not, and we're not talking about rationing of care. Now, that's what we're talking about right now as to how that trigger would work. So that's what we're discussing, and I'm happy to talk to you further about some of the discussions that are going on, with the Blue Dogs and with some of the Democratic members about how a trigger mechanism might work. But I'm very concerned about the savings as projected, not necessarily being there, and then imposing additional costs, especially on small businesses, as I mentioned earlier. Listen, I'll take one more, and yes, ma'am.
This is not my question, but I heard this today, that when Reagan was in charge, the taxes were something like 70%, and he took them down to 28, and tripled the revenue that he mentioned.
What we saw was also a tremendous increase in the deficit.
Let's go!
Question? Okay. The way I'm really told this, I'm not really side, some things just don't make sense, and I think what they're doing doesn't make sense. What we have doesn't make sense. Why don't we just do something that generates the competition?
Well, that's the conundrum we have.
Public plan! Public plan is the competition!
It's really not. It's still cash, isn't it?
This is our conundrum. That we know that we have serious problems in the existing system. We know that it drives up costs. We know that small businesses are dropping coverage one after another. And that's a real challenge. But sorry. We're going to wrap this up because it gets increasingly disorderly as we move on. So, listen, I appreciate the input that you've given to me tonight. Look, if I could just say your attention, I appreciate the input that you've given to me tonight. I'm going to continue to have conversations with a bunch of different folks during the course of the month. And I really do appreciate the input. I realize there are a lot of angry people. I do understand that. I get it. And I hear you. That's why I want to hear you. If I wanted to go, folks, if I wanted to go high, I would go high. But I have reservations about the bill that came forward. That's why I didn't want it to go to a vote on the floor. That's why I want to hear what other people's reservations are. But I also want to hear about potential fixes to some of the challenges we have in our country. So I want to thank you all I want to thank you all